Fentanyl trafficking from the border into San Diego County. And joining us now to talk more about the fentanyl abatement and suppression team is Marisa Varond. Marisa, great to see you. Thanks so much.
Thank you.
You're with the McAlister Institute. Tell me a little bit about that institute and how you're treating people who are addicted to all kinds of different drugs.
Sure. So for 46 years now, McAlister Institute has been providing substance use disorder treatment services across a continuum of ages and levels of care. And we've recently been seeing a huge spike in the number of folks who are coming in with fentanyl as a drug of choice. And so I think as we're looking at efforts in San Diego here to combat the crisis, we do have to talk about things like supply, but also demand.
Sure.
And look at not just those who are having fentanyl poisonings and pills that they may be purchasing on Snapchat, but also those who are seeking out fentanyl as their primary drug.
Talk about that supply and demand. I mean, we hear a lot of it's coming in from China or manufactured in China, and then it's coming across our border. It's obviously getting here.
It is, and I think that was one of the really big recognitions and reasons why we're seeing local, state, federal attention on our border here in San Diego. And again, the fact that we got to be part of this roundtable as a treatment provider is a recognition that just the supply alone will not fix the problem. We really need to make sure that we have a wide open door for those who need treatment as well.
We hear about people, they're buying a pill that they think doesn't have fentanyl in it. Maybe it's Adderall, I know you had mentioned that earlier during the break, or maybe it's oxycodone or another kind of drug, and it's a counterfeit pill and it's been spiked with fentanyl, and I guess the idea is you put a little fentanyl in, it doesn't kill the person, but they feel the high and then they want more. But it sounds like you're having people come into your facility saying, I'm addicted to fentanyl and I've been buying fentanyl, and we hear that just the tiniest amount of fentanyl can kill.
It's a both and, unfortunately, and we hear, youth who are buying pills on Snapchat with absolutely no intention of experimenting, and yet we also have people who, like you said, are choosing fentanyl as a drug of choice, and for them we're doing everything that we can to connect them to medication-assisted treatment. And whether anyone is using, not using, experimenting, I think one of the most important things we can do as a community is ensure access to Narcan, or sometimes you hear it referred to as naloxone. There's vending machines throughout San Diego County. It's now over the counter, and it's one of the most important tools we have to fight overdose.
We hear that slogan, one pill can kill. What can we do to stop so many deaths and overdoses with fentanyl and other pills?
Well, I think it starts with all of us coming together at every level of community, politician, lawmakers, law enforcement, treatment providers, and raising awareness, especially around the fact that recovery is possible, so those who are struggling, that there's help and hope out there. Carrying Narcan, it should be just as accessible as a fire extinguisher in every household, in every car, in every restaurant. And again, raising awareness and all of us coming together.
Is being addicted to fentanyl similar to heroin or cigarettes or things like that?
From the folks that we're seeing and talking to, it is a much more progressed disease. It is 50 times as powerful. And so if you think about all of the horror stories we've heard about heroin, when you look at a substance that's 50 times as powerful, it's progressing the rate at which folks are experiencing their addiction. It's taking hold of their brain that much faster. But fortunately, like I said, there are treatments out there.
Okay. Do you have a website if somebody wants to get a hold of your institute and see what you're all about?
Absolutely.
Okay.
McAlisterinc.org.
Okay.
And we are also so committed to access that our founder actually offers her personal cell phone number.
Okay.
So if you are looking for help, Jean McAlister will answer your call between 6 a.m. and 11 p.m. And that number is 619-987-6393.
Marisa Varond, thanks for coming by. We appreciate it.
Thanks for having me.
Okay, Teresa.
The Biden administration